Good afternoon to everybody who's joining in today. And I'm Dr. Shikha Sharma. And this meeting or this group session is basically to uh, sort of give you an overview of the program, and B also uh, so that you are aware of that as a founder of the organization, what is exactly the whole vision behind this organization. So firstly, thank you everybody for joining in. And it's a Saturday morning, and I can understand a lot of you must be kind of relaxing, and so it's really nice of you to all join in today. To reintroduce myself, I'm basically a medical doctor. I've done my medical degree from Maulana Azad Medical College, which is in Delhi, near ITU. It is associated with LNJP Hospital and GB Pant Hospital. So when I finished my medical degree, I was posted in the Department of Cardiology at GB Pant Hospital. So near ITO, there is this huge complex of Maulana Azad Medical College, GB Pant Super Speciality Center of Neuro and Cardio, and LNJP Hospital, which is a general hospital for all diseases and all branches of medicine. So when I was posted in the Department of Cardiology at GB Pant Hospital, as a very young doctor, I every day encountered death in terms of the patients dying. And for a young doctor who's just trained to save lives, this was very, very, I would say, upsetting for me, and hit me somewhere deep inside that as a doctor, I'm seeing patients at the fag end of their life when they have already destroyed most of the cardiac muscle. And by the time they came to the ICU, it was almost, the heart muscle was damaged more than 60%. So, I mean, what can you salvage? So, a team of doctors works on the heart patients. And despite a super specialty team, and I was, of course, the junior most in that team, but firsthand, when you see this, the first thing which you realize is that as doctors, we are meeting patients too late in the disease cycle. The patients whom we are getting are already damaged so much and we are seeing them very late in the disease cycle. And I thought this was a tragedy, because as doctors, we could do so much had we seen the patient earlier, had the patient come to us earlier. So that's, I think, where the seed of preventive healthcare started in my mind and in my heart. And gradually, I started looking at how preventive healthcare can happen. And obviously, at that time, what I understood was that nutrition is very critical to preventive healthcare. Most of the doctors, and by the way, I must clarify that as a medical doctor, we have no training in nutrition. There is no subject called nutrition in our training. I don't know now what's happening, but when I got trained as a medical doctor, nutrition was not even taught to us. Not even the ABCD of nutrition was taught to us. Because it was not even thought important enough to be taught to a medical doctor. And yet, when we took our oath, when we got our degrees and we took our oath, and our oath is modeled, it's a WHO version of the oath, but the original oath is modeled on the words of the father of modern medicine, who's Hippocrates. So Hippocrates had started the logic of modern healthcare, and that is why Western medicine calls him the father of modern medicine. But in reality, thousands of years back, medicine was already existing in India and China, and very advanced form of medicine was already existing in India and China. However, since I was trained in Western medicine, I had no idea about nutrition. I had no idea about Indian systems of medicine. I had no idea about Chinese systems of medicine. But the only thing I knew is that the patient was coming and dying on the table because we could not see the patient early enough to modify the disease. So when I entered into nutrition, I entered with a very clear heart and a very clear mind. I had no biases, nothing, just an open book. Just an open white slate. I entered the field of nutrition. And because I'd come from the field of medical science, so I understood the body very well. I understood what is digestion. I understood what is metabolism. I understood how the body is created, how the body functions. And that's why when I entered the field of nutrition, one thing which struck me as strange, and later I realized that it was completely unscientific, was the concept of calorie. In the field of nutrition, the concept of calorie is very prevalent. And coming from a science, medical science, I was shocked to see that this calorie concept was extremely unscientific. Now, I know a lot of you would be surprised and shocked to hear that the concept of calorie is unscientific, but I'll explain. So, the concept of calorie is based on a principle that food is eaten by the human. In the intestine or in the stomach, it is burnt off. And the energy released by this burning is the energy which humans use as human energy. Now, this is something which is very amusing and laughable, because this whole process is actually called the process. The process which happens is when you eat a food, it is systematically disintegrated or disassembled, I would say. So when you eat an apple in your mouth with the teeth, you separate the fiber and the juices. And then the fiber and juices travel inside together, but separately. Then within the enzymes, the mouth has enzymes and the stomach has enzymes. Then these juices are further processed, and they are actually like a scissor, they're snipped. They're enzymatic scissors. So these enzymes, they're like scissors. They make it smaller and smaller. It's like cloth. Like when you cut a piece of cloth, you're not burning it. So burning a cloth is different and cutting a cloth is different. So what is happening inside as we are eating is cutting. So first is the gross cutting by the teeth, and then is a very fine cutting through enzymes. And these are like enzymes, they cut it smaller, 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 smaller. Then they go inside the stomach, and the amino acids, the proteins, the proteins are broken down into their smaller versions called amino acids. Then they go further down, and the essential fatty acids are released from the cells. So when you eat an apple, it has amino acid, it has essential fatty acids, it has sucrose, it has fructose, which is broken down into glucose and sucrose, glucose and other molecules of fructose. Then there are vitamins, there are minerals. So they are different parts of what an apple is. And now the human body, which is so sophisticated, is separating each part, the fiber, the fructose, the amino acids, the essential fatty acids. And when it goes down into the intestine, systematically, they're removed and then repackaged and sent off into the liver. In the liver, they're further processed, and then these packets of food are released into the blood to travel to the entire body as raw material. Now you would say, what raw material? Now, the entire body, perhaps people don't know, is constantly breaking down and regenerating. So if you've ever had a cut, a skin cut, have you seen how it heals? First there is blood, the blood comes out, then the blood clots and then seals that wound. And then once it seals, fibers start forming to stitch it literally together so that it doesn't remain an open wound. And there is a scab which forms, a covering, a scab which forms and protects the wound. And then gradually, once it's healed, the scab falls off, releasing new skin. This regeneration is constantly happening in the body. So our skin regenerates, we know that. Every few weeks, new skin from below is coming up, and the dead skin from the top skin becomes dead and falls off. Our bone is getting remodeled. A small baby, such a small bone it has. And then it's constantly getting remodeled as it's becoming bigger. So if you've seen a small baby, the proportion it has are perfect. And yet, when the baby is growing, no proportion is disturbed. The baby grows very proportionately into a wonderful, aesthetically designed human being. Because this remodeling is constantly happening in the body, in the bones, it's happening, in the liver, it's happening, in the intestine. You have a new intestinal lining after a few weeks, completely new lining. The old one is destroyed and the new one is formed. And that is why human beings have longevity, because we have a self-repair mechanism. So when we talk about food, the food is required for the self-repair systems and processes. The brain cells are dying and new ones are coming. So what I'm trying to say is, to call food just as an energy source is very sad, because food is actually, the body is made of food. It is what, when we say jaisa an vaisa man, I would say jaisa an vaisa man tan. Your body, your mind is all the kind of food you have eaten. Now, if food is so phenomenally important, how could it be just called into a very limited, how could it be understood in a very limited sense as just an energy source? Let me give you another example quickly, and then we'll move on to how you can benefit from the program. If you stop eating, I mean, everybody thinks food is an energy source, but let me throw an example. Scientifically, you don't need any food. I mean, if you, I wouldn't say you don't need any food, but I would say if you stop eating food, you won't immediately die. Even though people say that food is an energy source, but no, you will not immediately die. Death happens between 35th to 40th day. Because in 35 to 40 days, the body runs out of raw material to regenerate. And that's when death happens. If you don't drink water, and imagine nobody even talks about water, people die in 3 days. Just 3 days, people will die. Zero water, 3 days death. And that is why when people do fasting, they never give up water. Never. Because 3 days is the max you can live without water. You have to consume water. Otherwise, zero water, 3 days death. But look at the bigger picture now. So without food and water, I mean, when I say water, I mean also without food and water. So without food, but drinking water is 35 to 40 days. Without food or without water, 3 days. But without air and oxygen, 3 minutes. So what is powering this body? Oxygen is powering this body. And the body is only a conducting mechanism which is using that power, using that energy source. So oxygen is the energy source. So now I've given you a fundamental, a foundation. Now, all of you have come to lose weight. All of you have come to the organization to lose weight. Now, let me help you understand what are you actually wanting to lose and what are you saying. When we say weight loss, the weight of the body is composed of your muscle, your water, your bone, and your fat. So muscle, water, bone, and fat. So technically, what you think you have come to lose is not muscle, not bone, not water, but actually fat. You've come to lose fat. And yet everybody is saying weight loss, weight loss. If you, in the market, a lot of people promise quick weight loss. But you know actually what is happening? They are making their patients lose precious muscle. which is so important for the body. Because without strong muscles, your entire backbone will get affected. Your knee joints will get affected. You will start looking old. Your facial muscles will get affected. Your posture will get spoiled. You will start drooping like this. And that's what's happening outside in the market. Just because people are not doctors who are into this industry, they are making patients lose precious muscle, and even patients are very happy. Oh, I lost 10 kilos in uh, 2 months. Without realizing that what have you lost? You have lost precious muscle. You have not lost fat. Because fat loss cannot happen like that. The first thing you quickly lose is muscle. For fat loss, there is a process. Like a baby cannot be born in 2 months. There is a process. Similarly, fat loss has a process. The fats all over your body has to be broken down. It has to come back into bloodstream. From the bloodstream, it has to come back into the liver. In the liver, it has to be redigested and then thrown from the intestine as stools or sweat and a little bit urine. This process takes time, and this process has certain rules. You cannot cheat this process. Like a lot of people today try to cheat the process. But what are they? You cannot cheat the body. The body is more superior than, because the body has, every cell has intelligence. So what we should actually be doing together is losing fat loss. Now you'll say, how will I measure my fat loss? Good question. Please take an inch tape and measure. Measure your arms, measure your abdomen, measure your waist, measure your chest, measure your thighs at two places, measure your calf muscles, measure your hips, and that should be the barometer of fat loss, not just getting on a weighing scale, losing protein, losing muscle, and feeling very happy that, oh, I've lost so much weight. No. And there are strict instructions in my company. No client can be allowed to do crash weight loss, because that's against our medical ethics. We are here to make you healthy. We are not here just to give you wrong advice, or if you do not know the correct picture, to allow you or to follow your instructions. In our company, we have to follow medical ethics and do the best thing for our patients, because we are not here to give you quick weight loss and later on you will suffer, and we know that you will suffer. So when I say weight loss, let's first change the vocabulary. We are here to help you lose fat in a healthy, scientific way. Number one. Number two, which is very important, is there are thousands and thousands of dietitians and companies who are not under medical ethics, who are not governed under medical ethics, because there are no doctors in that company. So what we as an organization are trying to do is actually make you healthy from the root, so that your liver is healthy, your digestion is healthy, your intestine is healthy, your facial skin is better, your immunity is better, your body strength improves. That is what, along with fat loss, we have to give you, because that's a scientific way of helping people get healthy. So our goal is to basically help you transform into a healthy person along with fat loss. And of course, it's part of the whole thing. Now, in order to do this, do you think, so when we started this organization, we had 100% dietitians who were trained in scientific weight management according to medical science. Then as we went along, I discovered that Vedic systems are very powerful because they understand food as medicine. The power of turmeric, the power of tulsi, the power of ginger, the power of garlic, the power of aloe vera. So we brought in professionals from the Ayurvedic field, not to give you Ayurvedic drugs, but to create a protocol where the nutrition part of Ayurveda was only picked up. The nutrition part of Ayurveda has all your kitchen herbs, has all the over-the-counter herbs, along with nutrition. And not only nutrition as calorie, there is no concept because I told you it's the wrong concept, but nutrition according to your body type. What is your body type? So first thing I will tell you is that it is very important that, let me first introduce the team, who all will be there in the team. So in your team, in my team, you'll be meeting the Ayurvedic doctor who will help you to understand your unique bioenergy type. Your unique bioenergy type is your basically the essence of your DNA. So when we call DNA, when we say DNA scientifically, we call it the genotype, which is a code, which is a biological code. And that DNA becomes a human being with a certain body structure, with certain hair, with certain metabolic type, with certain thinking, certain habits. That's called a phenotype. So a DNA in the visible human form is called a phenotype. So genotype is the coding. Phenotype is once the coding codes and creates a human being, what does a human being look like? That's called the phenotype. So Ayurveda has a system where using the phenotype, you can diagnose what is your genotype. And that's called your basic nature, your fundamental metabolic psychosomatic nature. So the Ayurvedic doctor will help you understand. My request is when they identify your phenotype, please memorize it, understand it, so that your future choices of food is based on what works for you, not wrong food combinations, not foods which don't work for you. So what I'm trying to say is that once you understand, like today, something which is very, again, surprising and funny is when we go out and buy a cream, the cosmetician will ask you, okay, do you have a dry skin? You have an oily skin? You have a combination skin? You have this, you have that, which is just a skin and just a cream, just one variable, one thing. But when you go and eat food, everything is mixed into a hodgepodge. Everybody's eating everything, whether it's suiting you, whether it's not suiting you. And that's where the entire problem starts. That's where health disorders start. There's a very old English saying called one man's food can be another man's poison. And this has not even come from Vedas. This has come from Western naturopaths who realize that one man's food can be another man's poison because your body type is not geared towards handling that food well. So you can eat it, you won't die, but it will cause problems. So that awareness, that self-awareness, that what foods are suiting me is enhanced many-fold once you know your body type, which the Ayurvedic doctor will tell you. The second person, the professional you'll meet is, of course, your personal nutritionist. So my request to all of you would be that when you are working with your personal nutritionist, please maintain the regime of proper appointment system. Do not take it casually. Because you'll be casual, your nutritionist will be casual, there'll be no results. So which means that please stick to your appointment time. Do not miss your appointments. Even when you're traveling, don't give a complete break because it takes ages for people to come back into the plan. So take a travel plan, but don't give too many breaks. This breaks is spoiling people's metabolism because they follow 3 weeks, then don't follow 1 week, then follow 3 weeks. I'm not saying you have to be rigidly following, but you can't just take a break and not follow at all. It will just spoil the entire system. Because once you start the process of metabolism and digestion of fat in the reverse order, if you just keep stopping, it will not be useful for you. So during the period when you are traveling or whether you are in some event or whatever, follow 50%, follow 35%, but don't completely go off because it will spoil the whole rhythm of what has already started. And in any case, it's not that you have to follow 100% or 0%. What we expect is anything above 50% should be good enough. 80% would give you great results, not only in terms of your fat loss, but actually your skin, your hair, your mood, your bones, your liver, your kidney. Your health will start getting transformed if you follow 100% or 95% or 90%. But at least follow above 50%. Now, the second thing which I want to share is that, so with your personal nutritionist, you will also have group sessions with a success coach, an emotional wellness coach. What we have seen is a lot of our clients, our patients, keep falling off the plan because they're depressed or they are stressed or there are a lot of other issues, which is very normal. We are human, we are emotional people. And that is why we have an expert, an emotional wellness expert whom I will introduce at the end of the session. And the doctors, at least one doctor who I'll introduce at the end of the session. We have many doctors, but depending on who's available, I will introduce to some of the team members. So, what is important is that the emotional wellness coach is specifically conducting online group sessions with all of you, which is part of the program, which is what you have paid includes these sessions. But you must come for those sessions. She will give you tips, tools, techniques, processes of how to manage your emotions. During the program, what is behavioral change? How to modify your behavior. See, as adults, behavioral change is very hard because it's hardwired into us. Bad habits are hardwired into us. But I believe after pandemic, people have started becoming more ready for the change. Before pandemic, it was really hard for people to change because they had never seen death so closely. But after pandemic, I think people are ready for change. People are ready to transform their health. So this is a good opportunity because all experts in the field of healthcare are attached to this organization. So doctor, like I told you, nutritionist who's personal, a success coach who works on behavioral change and stress management, and a yoga expert who does weekend yoga classes to open up your body. When you open up your body, your nervous system becomes strong, and then the communication channels in your body are very good. I see so many people having back problem, frozen shoulders, and this is all bad nutrition, bad lifestyle. So the body is getting damaged systematically. So we got all the professionals together, the yoga expert doing weekend online group sessions, the success coach working on the behavioral change and stress management, the personal nutritionist who's actually a trained holistic nutrition coach. So she knows Vedic nutrition and modern nutrition, and this is a blend of what we have brought in together. This is the protocol which I have built over lakhs of patients. And the Ayurvedic doctor who will give you natural solutions. We are also supporting by bringing in certain herbal teas. As a medical doctor, I realize the power of herbal teas. Hibiscus, rhododendron, sea buckthorn, jasmine, chamomile. There are wonderful herbal teas available, but two teas, and we are launching another one for reducing cancer risk. There's another tea which is coming up soon called the palm tea. But currently we have the rhododendron herbal infusion. Now, what is rhododendron? Rhododendron is basically branch flower. But in this tea, you have other herbs also. You have lemongrass, you have ginger, you have pepper, you have lemon peels. All these herbs, turmeric, along with these herbs is rhododendron, which is a very, very, very powerful inflammation reduction agent. It's a flower actually. It's consumed in the Himalayas as branch. But along with these other herbs, we are giving these herbal teas so that your inflammation in your body comes down. There's so much inflammation in people's bodies today. And because of that inflammation, the liver is not working properly. Their heart is not working properly. Their skin is getting damaged. So these herbal teas are to support your journey gently. And of course, there is jasmine infusion, which is to reduce water retention. Jasmine flower, wonderful flower infusion. So what are we trying to do? We are trying to transform your health gently in an interdisciplinary manner. That means getting all these professionals together under one banner, under one program, which is actually unique in the industry. So if you think that a diet chart will help you lose weight, a single diet chart, you can go home, it is not possible. I've set up this company and it's been more than 25 years. It doesn't work like that. You not only need a personalized nutrition plan, you also need help from coaches to help you go through that program. And that is why this interdisciplinary team has come together. The Ayurvedic doctor, the personal nutritionist, the success coach for behavioral change, the yoga coach. And together we will help you. Together we are dedicating ourselves to helping you become healthy. Because that's our mission. As a medical doctor, my transformation from a hardcore medical doctor giving medicines, drugs, to a person who's trying to help people to become healthy using the natural power of your body. The one thing which I learned, the body is most powerful healing machine. It just needs the right raw material. So this transformation is what we are looking for. What we want to work with you, partner with you. Now, a couple of things which I feel clients, patients have questions is that how quickly can I lose weight? It's very simple. If you follow the program to the T, your metabolism will rise, your inflammation will come down in the liver, and I would suggest don't lose more than 1 to 3 kilos a month. Because if you lose very fast, you are losing muscle. So this quick fix is never good for the body. You feel happy, I've lost, but actually what you're losing is muscle because fat loss takes time. Like I said, fat loss has a process. Now, in this process, what is very important is your body has to be alkaline. And that is why we are getting the support of all these salads and vegetable juices and fruits and rhododendron herbal tea, jasmine. All this is to make your body so alkaline that your fat starts coming out of the fat cells and getting excreted from your intestine. And one thing which I will request is you are not supposed to starve. It will destroy the whole process of fat loss. The moment you starve, the fat cells start holding on to fat. You're sending a very strong signal to the fat cell that I'm starving. Fat cells will hold on to fat. Don't give that signal. Don't starve. You cannot starve. And that is why in our program, there are some people who say, I don't like salads. I will not eat it. I don't like vegetable juice. I will not drink it. I don't like fruits. I will not eat it. That is what's harming the weight loss process because these are important to release the fat from the fat cells. The vitamins in the fruits, the enzymes in the vegetable juices, the antioxidants in the herbal teas. It is for a purpose we are giving them. So a lot of people who have already done very bad diets outside have learned bad habits. And when I say bad habits, they're destroying the body. They're losing more and more muscle tissue. And then after a point, the metabolism is totally stuck. To rev up the metabolism, we have to start first feeding them fruits, salads, vegetable juices, giving them functional foods so that their metabolism starts coming up. So that metabolism will use the fat. The metabolism will take out the fat and release it from the body. And the fat loss which happens through the correct program is more proportionate. It will not make you look old and aged or sick. A lot of people who have done crash diets come out looking as if they just had tuberculosis. And when we discover what they were eating, they were having all these zero-calorie foods. Now, what is zero-calorie food? Look at Diet Coke or Diet Pepsi or any fizzy drink. It's zero-cal. but it's having chemicals, aspartame chemical, artificial color chemical, artificial flavor chemical, artificial taste chemical. And all these chemicals are entering your body and then hitting your liver and causing a lot of inflammation. The liver is inflamed, metabolism is affected, metabolism is getting deteriorated, is getting attacked, and the person is losing muscle. So, what is the typical way a calorie controlled person will look? They will look gaunt, their cheeks will be sunken, their arm muscle will be down, their leg muscles will be coming down, and loose fat is simply hanging. So, on the weighing scale, they are less, but physically they look like they've just come out of a disease. If that is the weight loss you want, that's the kind of weight loss available across in the industry, again, because there are no medical doctors supervising this, no medical doctors involved deeply in this process. So what I'm trying to say is that today obesity is being recognized as a disorder. 25 years back, I recognized obesity as a disorder, as a function of a bad nutrition and bad lifestyle. And that is why I put together this organization to do it in the right way, to do it in the honest way, to do it in the ethical way, to do it in the scientific way, without compromising on our ethics. So when you go through this program, I would encourage you to learn and transform yourself. We also do a lot of doctor sessions, awareness sessions. Please join those sessions. We try to do them only on weekends so that you benefit and you have the time to attend those sessions. But what I'm saying is that the pandemic has taught us that the body is very precious. And the only way you can treat the body well is to nourish the body appropriately. Because the kind of chemicals today which are coming up from the industry are so much that if you don't educate yourself about what to eat, what is suiting you, what is your body type, you will be surrounded by a lot of confusing myths. And then you'll be going from one diet to another. 3 months this diet, 3 months that diet, 3 months this diet, 3 months this diet. You'll be just going from one diet to another and in the process ruining your body. So with that, I would, Suraj, if you are there, Komal, if you are there, I would like some of you to open your screens, camera screen, so that I can start introducing some of my team members. And also Dr. Shivam, if he's there, Kanika, if she's there. So whichever team members can join in, I would like to just you to open your screen and introduce yourself. Yes, is Komal there? Or Sneha or anybody else?
Yes, ma'am.
Any one of our nutrition team members?
Ma'am, hi. This is Komal.
Yes.
Am I audible?
Yeah, Komal, you're audible.
Yeah, ma'am, my webcam is not working. It is creating some issues. So I'll introduce myself.
Okay.
I am Komal, service team leader, and we have been organizing these introductory sessions with Dr. Shikha ma'am on a regular basis uh, to to maintain a consistency and to motivate all of you on a consistent basis so that you are able to stick to the plans, and in case any issues are there, the particular team leader provides their official number in case any issues are there regarding the nutritionist or the services or anything else that you're not able to stick to our plans. So please get back to the concerned team leader's official number, and we'll be available to help you out there.
Thank you, Komal. And in the meanwhile, if you could organize other team members to come and introduce themselves. And in the meanwhile, there's
Sure.
one thing which I must share with all of you. A lot of patients ask, why doesn't Dr. Shikha Sharma give diet plans? Why doesn't Dr. Shikha Sharma do consulting herself? So there's a reason behind it. The reason is that when I set up this whole protocol, God was kind, and a lot of powerful people in the country started taking my advice. A lot of politicians, a lot of film stars, and then one fine day, the prime minister was my client. The day the Prime Minister became my client, I got a inner voice telling me that from now on, you will not give consulting to anybody. You will not focus on your own self. You will now focus on building an organization which can carry this work forward, because there is nobody in the country doing this work. So the inner voice literally stopped me from consulting, because if I had continued consulting, I would become a very prosperous, wealthy woman in my own right, but there'll be no company. Because as a human person, giving up all your knowledge and your focus and your dedication to building an organization takes a lot of uh, sincerity, hard work, and you have to give up. If you don't give up, then the temptation of just doing it for yourself is very strong. So that inner voice, which I believe even the Prime Minister became my client because the universe was trying to tell me something. And after that, I completely stopped consulting. So there are no personal consults ever. Even for my family and friends, they will meet my senior nutritionist. So the goal or the purpose of my life is to dedicate myself to building an organization which can help people prevent diseases in the way the body can do. I mean, the body doesn't need to get mutilated. The body doesn't need to get full of chemicals. It can heal itself. Well, I'm not saying that you don't take allopathic medicine. No. Take your allopathic medicines, because those will support you like a crutch till the time your body recovers and is able to handle the healing. So don't leave the crutches till your bones are strong. So the allopathic medicines will help you. And once you transform your health, once you transform your habits, then yourself, your allopathic doctor will say you don't need this anymore, because all doctors, allopathic doctors from my batch, they believe in this system. So what I'm trying to say is, it is not an allopathy versus holistic healing. It is not allopathy versus Ayurveda. It is basically the patient, what is the capability of the patient. If you can't change your habits at all, then allopathy will protect your life. But if you are willing to change your habits, then gradually, your allopath doctor will be so proud of you. He'll say or she'll say that you don't need so many medicines. Let me cut down your medicines. So we all are working together to actually give you health and longevity and a better quality of life. I think another teammate is here, Kanika. Yeah, would you like to switch on your camera and introduce yourself?
Good afternoon, everyone. I am Kanika, the success coach at One Health, and I'll be helping you all in breaking the barriers of emotional eating. So, I conduct regular group sessions for our clients also, and the topics that these sessions have are like stuck weight and emotions, in which we tell you how your emotional eating happens. Because sometimes it's like you don't eat from your hunger, you eat out of your emotions. And the next topic that we would be covering is cravings, because our food cravings are not just our eating habits, they are related to our emotions. And other topics that we are going to cover are the effects of sleep on lifestyle disorders, body positivity, and harmonious relationships. So till now, I have counseled a lot of clients who were dealing with emotional eating and emotional traumas too. So I'll be happy to take you all as my client, and uh, we also have free of cost workshops on a daily basis, which are held at 5 p.m. every day. And besides this, if you need any kind of emotional help, we also conduct one-on-one therapeutic sessions, but which are paid separately in our system. So, off to Dr. Shivam now.
Now I'd like to introduce Dr. Shivam. So we have a lot of teammates, but today I'm introducing some of our teammates. Yeah, Dr. Shivam, please open your camera.
Uh, hello. Thank you, ma'am. Am I audible to everyone? Okay. I'm Dr. Shivam Maheshwari. I'm I'm an Ayurvedic doctor, certified diabetes and heart disease reversal expert. So we will in the ongoing session we will talk about prakriti in Ayurveda, Ayurvedic medicines. We'll talk about. So as we know, according to five elemental theory, so our everything in the entire universe is made the five element. Take example, everything is made up of five things like prithvi, jal, agni, vayu, akash, right? So our body is also resonate all the things that are in the entire universe. Everything have different constitutions of these five elements. Like take an example, apple of and watermelon. The apple and watermelon. If we compare these two, watermelon have more water element compared to apple. So our body, there are different types of bodies. In modern we say endomorphic and ectomorphic and mesomorphic. In Ayurveda we say Vat Pitta Kapha. Vata is like air dominant. The person who is having dominant, air element dominant, can we say as Vata Prakriti. So when the person take nutrition, synchronizing to his doshas like Vata, his body can make he's having creative activities, and if he's not resonating with the vata, so he or she can feel some doshas imbalance, like he can feel anxiety, stress. So we have to first line of ayurvedic treatment is food. As in our study, in 5 years of study, uh, like we focus on food as a medicine. So our first medicine is food. So we have to resonate our food as a medicine. Thank you. So in on the ongoing session, we will discuss about the prakriti, body types, and the food according to the prakriti. Thank you, ma'am.
So I'm happy to share that the lakhs of patients who have gone through our program, some of their own experiences have been captured, and I will ask my team members to share those experiences, their videos with some of you. Uh, it's just to help you understand that food is a very powerful medicine, because we really underestimate food. We grossly underestimate food. So I'll ask all my team leaders, please do share some of those client videos with the people who have just joined the program, so that it will motivate you and help you understand how powerful food can be. I would also request that there is a Vedic app. Please do use the Vedic app. There is a lot of knowledge videos, recipes. Your plans will come in the Vedic app. Uh, and it has a special feature called the chat feature. So I'll encourage all of you to please use the chat feature. Now, as a company, we respect the privacy and the timing of our dietitians, and and that is why we do not give personal mobile numbers to our clients, because sometimes it's very difficult. The dietitians need their own privacy, their own time, their off time, and it's hard to do that if their personal numbers are given out. So the app has been created only to maintain the professionalism and the boundaries where the dietitians can also enjoy their own personal life and personal time. So please do use the chat feature. In case you have any issue, there is an email. All dietitians will give out their email ID, individual email ID to you. You can reach out on the email. And every second day, the dietitians will be talking to you. The nutritionists will be engaging with you, talking to you. Please do share your feedback in terms of any gas, any acidity, any improvement, anything which you feel following the program. And the intensive compliance monitoring system has been designed specifically so that you are completely supported through the journey. In fact, I would say that Harvard Business School has recognized our process as a case study. So we are very proud to share that Harvard Business School had recognized our process as a case study in the field of preventive healthcare. So please do follow that plan. And like I said, whether you go to a spa, whether you go to an ashram, or whether you go to an institution, we all go to help us transform our health, which is very hard to do it on our own. So if you do respect that that feeling, we are here. All of us are here to support your journey towards total transformation. And the happiest people are us. And I can vouch for all my dietitians. It brings a smile to their face when the clients say that some client was not able to conceive naturally, and she had 2 failed IVFs, but she went on this program, reduced her inflammation, shed fat, and she conceived naturally. There are cases who reduce their hypothyroid medication to almost minuscule dose. Some people, their LFT functions were completely off the charts. And with this program over a few years, their LFT became absolutely normal. So this is a very powerful program. Please do follow it with sincerity and you'll see amazing results. So with that, thank you so much. Wishing all the women who have come today a very happy Women's Day. And with your support, I hope that you will not only transform your personal health, but also your family health. Thank you so much for joining, and have a wonderful weekend ahead.